Well, it's 12 o'clock here on the East Coast, so we can go ahead and begin. Want to start by saying hello and welcoming everybody to the webinar, and I want to wish you all a happy summer solstice as well. It's a day early, but the first day of summer is upon us, and it's really exciting. It's actually starting to feel like summer here, so really excited about that. So thank you everybody for taking part in the webinar today. We are really excited to introduce this series of webinars that are specific to Canadian services for CQL. And the hope today is to reintroduce ourselves. I really want to have a conversation about some of the things that we're doing in Canada, and we'll take a look at CQL, and in the spirit of reintroducing ourselves, we'll kind of talk about what CQL does in terms of training, accreditation, and some of the initiatives that we have going on. So we really do want this to be a conversation. So if anybody has a question, feel free to type it into the box, and at the end we can unmute you as well. If you want to raise your hand, we can have a conversation that way as well. So first, I'll just introduce myself. My name is Michael Clausen, and I am the Canadian Services Liaison for CQL. I have been training and using personal outcome measures CQL since 2012. I've been working for CQL since 2014. Prior to that, I worked for a provider organization in upstate New York, and that's where I'm from. I live in Plattsburgh, New York, which is about 20 miles from the Canadian border, about an hour south of Montreal. I grew up within a stone's throw of the Canadian border, really just a couple miles down the road. So I spend quite a bit of time in Canada. So that's me. And so we are, just want to go through and talk a little bit about CQL. And for those of you that are already working with us, you may already know some of this stuff, so just bear with us. But we do want to just talk a little bit about what we do. CQL is an international organization. We provide services in Canada, the United States, in Ireland, Australia, and New Zealand. So we're all over the world, all over both countries, Canada and the United States. And we believe in a world of dignity, opportunity, and community for all people. And we're really dedicated to the definition, measurement, and improvement of personal quality of life. So hang on to that word measurement. We're going to talk quite a bit about that today. And so we really help organizations to look at their systems and enhance the quality of their services. So this is really all about enhancing quality both systematically and on the individual level as well. And really what sets us apart is that the standards that we use are the standards that are most important to people that are supported. So that really is what sets us apart. People define what is most important to them and what really matters in terms of their services. A little bit of history here, some background on CQL, where we came from. We started out as the Accreditation Council back in 1969. And as you probably know, there was a lot happening back in 1969, deinstitutionalization here in the United States. And, you know, it's a really monumental in terms of the way that services were shifting at the end of the 60s. So there's a lot happening then, and that's really kind of the roots of CQL. And importantly, back in the 1990s, we developed the personal outcome measures. So they've evolved a bit over the years, and we started out with 30 personal outcome measures, and then it became 25, and now we have 21. And we're going to talk a little bit more about that this afternoon, that the effective June 1st, we have once again restructured the personal outcome measures. So all of the intent has remained the same, but we've shuffled it a bit in terms of factors. So we'll take a look at those in just a little bit. So really what CQL does, we offer a number of services. We do a number of different things to improve the quality of life for people that receive supports. Accreditation, training, we have a big emphasis on data collection. We operate a database that has more than 10,000 personal outcome measures interviews in it, and we actually just made changes to our database as well, effective May 1st. We have a new database, so that's exciting as well. It's really nice, and it allows organizations to slice and dice data and look at it in a number of different ways to help to improve the quality of your services. So the first thing I want to cover today is CQL Accreditation. We use a number of tools to be able to measure service quality. So basic assurances, we really look at systems relating to health, safety, security. We use the personal outcome measures, which we'll explore a little bit. And again, these are the personally defined outcomes that people define as most important to them. With the shared values, we look at the alignment of mission, vision, and values of organizations, and we also focus on community life. So we currently offer 3 types of accreditation. So we start with quality assurances accreditation. We see this a lot with organizations that are new to CQL. This is a 3-year term, and we focus on the basic assurances. We use the personal outcome measures. We look at shared values and community life. Our person-centered excellence accreditation, this is a 4-year accreditation term, and it includes 1 on-site visit, 2 off-site visits, and this is more ideal for organizations that have quality management systems already in place. So organizations that are already using the personal outcome measures and have other systems that are already set up to be able to look at the quality of services. So this builds on some of our tools, and we assist organizations to build a what really matters plan. So it's kind of a roadmap that organizations put together to come up with goals to look at over the next, over the short term, really, over about 1.5 years. So that's really what's distinctive about the Person-Centered Excellence Accreditation. And then we also have the Person-Centered Excellence Accreditation with distinction. And so this is for organizations that are using the personal outcome measures in a big way. So organizations that have CQL certified trainers or interviewers, and again, organizations that are already collecting data, utilizing the personal outcome measures to build upon what they're doing. And so accreditation, some of the things that set us apart is that we really pride ourselves on the partnership aspect. We're not surveyors or auditors. We really take pride in the fact that we partner with organizations to improve service quality. So not only do we measure when we're on the ground and look at policies and procedures and what's happening at an organization, but we partner with organizations to take what they're doing to the next level. And so that's really our approach, is appreciative inquiry. So we look at all of the strengths of the organization and we work to build upon that. So a little look here at some of the tools that we use to improve organizational quality. Starting with the shared values, we have 10 factors in the shared values, and so this is a systems approach in looking at all of these areas, from self-determination and choice to social capital to shared leadership and open communication. We use the basic assurances to look at areas like rights, protection, and promotion, health, safety, staff resources, and supports. And we also look at basic assurances systems, so the organizational monitoring plan for improving quality. And we also use a tool called the What Really Matters. And this is really about the person-centered assessment and discovery, supports and services, workforce, emerging best practices in individual budgets. And so the What Really Matters, this is used as part of the Person-Centered Excellence Accreditation, and organizations will choose focused areas that they want to work on over the short term. And so again, with appreciative inquiry, we build on strengths and we help organizations to carry those strengths forward. And this is what really sets us apart. So I want to take a little bit of time to look at the personal outcome measures and the new factors that we've set up. We did have some webinars recently devoted to personal outcome measures, and those are on our website if you want to check those out. And I'm not going to spend a whole lot of time talking about the personal outcome measures because that's already been done, but just a brief overview of the new structure, and we'll take a look at those. So we now have 5 factors. We went from the 3 factors, myself, my world, my dreams, to 5 factors: my human security, my community, my relationships, my choices, and my goals. So these are structured a bit more logically and concretely. They're not quite as abstract as they were before. And so we begin with my human security, which is the non-negotiable human and civil rights. And so we have 7 factors in that area: safety, abuse and neglect, people have the best possible health, people experience continuity and security, people exercise rights, people are treated fairly, and people are respected. Our second factor is my community. So really we look at access, being part of, and what people do when they're in the community with these areas. So we have 4 factors, 4 outcomes in this area. People use their environments, people live in integrated environments, interacting with other members of the community, and participating in the life of the community. The third factor, my relationships, we look at social supports, familiarity, intimacy, and belonging. And so with this area, people are connected to natural support networks, so all those familial relationships and lifelong relationships. People have friends, people have intimate relationships, people decide when to share personal information, and people perform different social roles. And the fourth factor area, my choices, we have the 3 outcomes there. So all of these choice outcomes, and again, you know, big emphasis on control here. People choose where and with whom they live, people choose where they work, and people choose services. And finally, the 5th factor, my goals, we look at dreams and aspirations for the future. With people choose personal goals and people realize personal goals. So a bit on how we use the personal outcome measures to improve quality of services and quality of life for people receiving services. So again, there's an emphasis on measurement. So we have conversations with people with the personal outcome measures. We facilitate those conversations, and that allows us to measure. And so several different types of outcomes here. So functional outcomes, increasing functional status. So an example of that might be to increase your abilities in a certain area. So that might be increasing your social skills or increasing your ADL skills or your ability to do a certain task. Those would all be functional outcomes. With clinical outcomes, we are talking about cure and symptom reduction. So we are talking about things that might be measured by your doctor. So it could be if you're a diabetic, a clinical outcome would be to decrease your HA1C. That would be an example of a clinical outcome. So personal outcomes are issues that matter most to people in their life. And so the big difference here is that with functional outcomes and clinical outcomes, those are defined by professionals. So your doctor might tell you what your ideal HA1C or body weight is. With functional outcomes, that might be measured by a staff member that's working with you and helping you to develop your plan, whereas personal outcomes are defined by the person. So when we look at the 21 personal outcome measures, no matter what area it is, they are all defined by the person. So if we're looking at people have different social roles, we want the people to tell us how much they want. So the quality and the quantity of social roles that they want in their own lives. They define it, they tell us what they want in that area, and then we measure it accordingly based on their standards. So it really is a focus on what's most important to the person, and the service action should be based on what makes sense to and for the person. So we really look at what they want in a given area. We learn about how they define it, and then we look at the service action and whether or not that service action is responsive to what the person said that they want. And importantly, the 3 E's. We use this a lot at CQL: experience, education, and exposure. And so really, this is what you need to be able to make an informed choice. I really like the ice cream analogy. So if you've only had vanilla ice cream your whole life, then you can't really make an informed choice about ice cream. And so if all you know is vanilla, then you don't know about Ben & Jerry's Chunky Monkey or Cherry Garcia. And so we really want people to have the education, experience, and exposure so that they can make those informed choices. So when we're talking about people choose where and with whom they live, they can't make an informed choice about their living options unless they've experienced and been exposed to an array of options. And so, those options might include group living with other people receiving services. It could be an apartment in the community. It could be some other supported kind of setting. And we also want to know, do people want to live in the city or the country? And we really focus on that array of options. And so the 3 E's are very important for people to make an informed choice. And so when we look at quality in services and outcomes and supports, this is really what drives us here. So the outcome for the person is a reflection of the person's quality of life, and the individualized supports are a reflection of the quality of services that the organization is providing. And they coexist. So we can't have one without the other. We really need to look at both in order to be able to measure. And so, just to sort of contrast here, the way that services and systems were looked at in the past and the way that quality was looked at in the past, as opposed to the outcome approach. Whereas in the past, a focus was on the program standards. With the outcome approach, the focus is on the person supported. And so, whereas in the past, service action was based on criteria that was established by professionals, so whether that professional was a clinician or the person writing the plan, with the outcome approach, the service action is based on the person's criteria. So the person tells us what's most important to them. And whereas in the past, the person was assigned to the program, we want the program to be designed for the person that's receiving the services. And the expectations are defined by the person as well. And so that's really the outcome-based approach. And that's really what we focus on with the personal outcome measures. And so, whereas in the past, we would focus solely on quality assurance and meeting compliance requirements, health and safety requirements, and kind of checking those boxes, we focus on quality enhancement. So we use all of those tools to enhance the quality of services. And so I wanted to talk a little bit about the training menu for Canada. So we offer an assortment of different trainings in Canada, beginning with the Personal Outcome Measures Assessment Workshop. And so the goal of the assessment workshop is to train people to use the personal outcome measures to measure. So we have the full 4-day workshop, and this is an in-depth approach. And so the workshop is a lot of hands-on learning. Staff get to practice doing interviews, and it really is hands-on. So at the end of the week, we want people to go out and to be able to do personal outcome measures interviews on their own. We also have a personal outcome measures introduction. So this is a 1-day workshop, and that's up to 40 staff. And this is more of a broad overview. So it's not training to use the personal outcome measures. It's more an overview to understand what the personal outcome measures are all about. And so this is really a good one for organizations that are new to the process, new to the personal outcome measures. And we also have a training that's focused more for direct support professionals. And so this is really an approach that allows them to apply the personal outcome measures to their everyday responsibilities in direct support work. So again, this is a 1-day, and it's focused on using real-life examples of DSPs embracing the personal outcome measures. We offer principles of person-centered thinking training, and so this is key components of the philosophy behind person-centered thinking, and we also incorporate the personal outcome measures into that, how to apply the personal outcome measures into person-centered thinking. We focus on best practices, and this training is designed for management quality assurance teams, direct support professionals, and anybody else that helps in the service planning process. We have a person-centered planning with outcomes training, and this more strongly is the application of the personal outcome measures into the person-centered planning process. And so this is really designed for staff that are involved in POM interviews and individual planning. And this one is a 1-day workshop. And we also offer a supporting rights and self-advocacy training. So This is a one-day workshop supporting people to understand and exercise their rights through the use of real-world scenarios. And this one is designed for quality assurance teams and direct support professionals. We offer a supported decision one-day workshop. We focus on the essential components of supported decision-making. We look at best practices and specific examples of where supported decision-making is working. And so supported decision-making, this is sort of a up-and-coming philosophy. So in some places, supported decision-making is written into law, and in some places it's not, but it still can be used to guide people in supported decision-making. You know, it can be used as an alternative to guardianship or other more restrictive forms of formal support for people. And we have a defining community training. This is a one-day, and this is really focuses on social capital and helping people to become parts of their community. And this training is designed for direct support professionals. We have a one-day appreciative inquiry training. And so again, appreciative inquiry, looking at what organizations do well and building upon it. This training is designed for management, quality assurance teams, and direct support professionals. We offer a one-day communication training, and this is all about understanding and enhancing communication methods and listening. This training features a lot of interactive exercises exploring communication methods, and is designed for management, quality assurance teams, and direct support professionals. And we also offer a two-day workshop for accreditation preparation. So this one is ideal for organizations that are new to the accreditation process to help them prepare for accreditation. So CQL offers a couple levels of certification as well. We have my computer keeps getting stuck. Apologize about that. Interviewer certification for staff that have been through the 4-day personal outcome measures workshop. And so this allows staff to become what we call reliable. So by reliable, we mean that the data that is collected through the personal outcome measures interview can be used to look at what organizations are doing, and when staff become reliable, that data is valid, and organizations can make decisions based upon that data. So there's a process, there's a coaching day, and there is an assessment to determine whether or not that staff is reliable. And reliability interviewer certification is a 1-year term. And we also have trainer certification. So we train staff to teach personal outcome measures workshops at their organizations. And so this is, so all trainers are also reliable interviewers, so they go through the reliability process as well. And so this is ideal. This allows organizations to have in-house experts to do the personal outcome measures workshops with their staff at any time. So just a quick look at some of the partners that we currently have in Canada. We have 5 of the community living organizations in Ontario, and we are also partnered with Simcoe Community Services. So these organizations are all accredited, so a shout out to them. Just want to talk a little bit about the webinars, we are in the planning phases of of more webinars. The next one will likely be in September. We're not going to do anything else during the summer because we understand that summer is a very busy time, so we don't think we would get very much attendance if we did have webinars during the summer. So we are looking at September and then possibly October, and then we hope to continue the webinars either on a bi-monthly or a quarterly basis. And what we hope to do is partner with experts in the field to present topics of various interest in Canada. So now I want to take a quick look at our web page that is specific to Canada. So we'll go there. So this was launched recently. We have a page that is specific to Canada. And so we have a number of areas here. We'll just kind of take a look and, from the general overview, and really, this explains all that we're doing in Canada currently, from accreditation, training, certification. You can learn about upcoming webinars and other resources. So we have the pages that are devoted to these specific areas. So accreditation and the accreditation menu, and we have links to learn more, as well as the option to download the request for engagement form. So organizations that are looking to become accredited can access that page to start the accreditation process. We also have a training page. So all of the trainings that I just talked about are here. And we have links to contact CQL to schedule those trainings, and links to learn more about those trainings. And a page devoted to certification. So if you want to learn more about becoming certified, we have the links to that, as well as links to contact CQL directly to schedule or ask more questions. We also have a sign up for our new Canada Connect e-newsletter. So if you want to receive communications from us, our new e-newsletter, or information about upcoming webinars or other CQL events, this is the place to go to sign up for that. And we have a page devoted to our webinars. So all of the upcoming webinars will be announced here as well. So there's me. So we have a page devoted to support as well. So if you want to get in touch with me to ask questions or chat, then you can do that. That's my email and phone number. So that is our new web page. I have to give credit to Seth Petrie. Seth is our director of marketing, and Seth, the web page looks great. So thank you for doing that. All right. So again, we have a new e-newsletter that we're launching. So with the email updates. So if you want to get those communications, then you can go there to get those. So I also want to talk about something new that we recently developed, the crosswalk of quality. So the crosswalk of quality, we wanted to demonstrate the practical application of quality enhancement tools that CQL developed to regulation in Ontario. So we wanted to show the alignment between what we're doing at CQL with the quality assurance measures in Ontario. So we'll just take a quick look at this. This was developed recently, and so the intent of the crosswalk is to show that alignment and to show ways to measure how you're doing in those areas, and show ways that quality can be enhanced through CQL tools. So from the basic assurances to the person-centered excellence factors that we talked about, and the personal outcome measures, and the did I miss one? And the shared values as well. So we just kind of crosswalk them. So we look at all of the quality assurance measures, regulation in Ontario, and we looked at the alignment to the CQL tool. So from promotion of social inclusion, individual choice, independence and rights, we can see that there are several things that we do at CQL that are in alignment with that. So we can use those tools to build upon the regulation that's there and enhance quality. And so we focus on all of those things. And so we have, I'm just going to scroll down here a bit. We do that with the behavior intervention strategies regulation as well. So we look at that, and then we can look at where we're in alignment with those things and the tools that we can use to enhance quality in those areas. So what that also allows you to do is use the tools that we have in place to measure. So when we look at these areas within the Ontario quality assurance measures, this will show you what tools that you can use to measure how you're doing in those areas. And so the crosswalk is available on our website for download. So that's here. So we have a tab dedicated to that. So you can find that there, and that is available for download. Okay. So another upcoming thing, CQL will be at the Community Living Ontario Conference. We're going to have an exhibit there. So for those of you who are going, stop by our table, come visit us. And we're really excited about that. And so at this point, I want to open it up for conversation. So we'll just kind of open the floor. So if you have questions or you want to make a point about something or be part of the conversation, you can raise your hand and I can unmute you, or you can just type it into the box. Any questions? Okay, Sherry has a question. I'm going to try to unmute you. Hello, Sherry. You are unmuted.
Oh, here I am. Can you hear me?
Hey, there you are. Hey, Sherry.
Sorry. I needed a reminder to turn my mic on. So I'm Sherry Emerson. I'm with Community Living Access in Simcoe, Ontario. And I have a question about the 5 new factors. And I was wondering about, are there going to be changes to the CQL Post app as a result of those factors, do you know? Or is it not going to be impacted at all?
Yeah, that's a great question. Actually, I will, let me see, Seth, do you have the answer to that question? Do you know what's going on with the Post app?
Yeah, there will not be any significant changes to the Post app regarding the factors, since all the indicators individually are the same. But the way that the Post is organized won't change, but we won't be removing the previous factor pages, slides that were on the Post app.
And will that just be done through like an app update, like any other app update from an app store?
Correct. Yeah, you'll receive a notification that an update has been made, and then, like you said, it's the same as any other kind of app update.
Okay, perfect. Can I ask another question?
Yeah, sure.
Okay, I was just wondering if you had a list of the agencies in Ontario that have staff that are certified as reliable interviewers and trainers but aren't necessarily accredited. We're not accredited, but I was just wondering how many agencies are like us who are using your tools and just necessarily aren't accredited.
I don't know the exact number on that, but I know that there are quite a few. So yeah, so not everybody that's using the personal outcome measures is accredited, and we do certify a number of people at organizations that are not accredited. So I don't have an exact number, but there are quite a few out there.
Okay, great. Thanks, Michael. That's all I needed.
Okay, thank you, Sherry. Okay, let's see what else. We have some more questions here.
That we're still here.
Anybody else have a question or want to talk? Okay, Tina has a question. All right, Tina, I am going to unmute you. Okay.
Hi, Mike. People
Hey,
hear
how you
me
doing,
okay?
Tina?
Yeah, good. I just wanted to say that was a good presentation of the information that was available. I think it's nice to see the Canadian content to it. In terms of what Sherry was asking, I think we have more than awareness of more than 20 organizations that are still using personal outcome measures. Not all have maintained an reliable interviewer status within their organization, but we've heard from lots that they're still using the outcomes, but quite a few do have reliable interviewers as well.
Okay, well, thank you for helping us with that. All right, great, thank you. Okay, any other questions? Let's see. Sherry, your hand is back up, so I'm gonna, or maybe we never put it back on. Sherry, did you have another question, or did I just not put down your hand?
No, I did, Michael. Actually, it came from one of my team who's in the room. Will you be providing some new slides for our self-assessment workshops? And will there be new books developed, or what can we look forward to in terms of the new content?
Yes to both of those questions. Actually our books have gone to the printer, and so you will be able to order those new books, and they will be provided for free electronically. So we will be providing a PDF version of the manuals to organizations that are using the personal outcome measures, along with the new presentation, the new slides.
That's great. Do you have a time frame on that, Michael? I'm just asking because we've got a self-assessment workshop coming up at the end of July.
Oh, okay. Yeah, let me see. Seth, do you know the answer to that one?
Yeah, so like Michael mentioned, the manuals are actually in print this week. So they should be available to you for your July assessment workshop. And also as far as the electronic version, it's actually already available online. If you go to our publications page on CQL's website, it's available for electronic download there. But yes, for your July assessment workshop, you'll have those new manuals and materials available to you.
Okay, and the new slides as well?
Correct, yep.
Perfect, thank you so much.
Absolutely.
Okay, thank you, Sherry. Okay, all right. It looked like Diana had a question. Diana, your hand was raised. I see that it's back down. Diana, did you have a question?
Hi.
Hi.
Okay. Oh. Can you hear me?
I can hear you.
Oh, sorry, my apologies. I did have a question with regards to the presentation today. Will we be getting a copy of it?
Sure, yep, we did record the presentation. Seth, is this going to be on our website, the recording?
Yes, so we will probably, I'd say by the end of this week, we will be embedding the video recording on the website as well as sharing the slides where you can download those. We'll be emailing out to all registrants and attendees when those are available with a direct link where you can access them.
Okay, that's great. Thank you.
Okay, thank you. Okay, let's see if we have any other questions here. Tina, your hand is up. I don't know if that's just because I didn't put your hand back down, but I'm going to unmute you. Tina, did you have another question? I
didn't, but I just want to say thanks, I guess, for this, and I look forward to who's ever going to be on the call later in the week, and hopefully this will be a start of something that's going to keep us all connected a little bit better than we have been over the last couple of years.
Okay, looking forward to it. All right, thank you. Okay. It looks like that's it for questions, unless there's anybody else that has a question. If you do, just raise your hand and we can get you on. Looks like that's it. Well, thank you again, everybody, for joining us today. And we are firming up the details on some webinars for the fall, and they should be really exciting. So stay tuned for that. I want to, if I can advance my slide here, my computer's stuck again. Oh, there we go. I want to wish you all a happy Canada Day as well, and a happy 150th birthday. This should be the biggest party ever in Canada. So that's really exciting. So have a wonderful and safe holiday. Enjoy your summer, and you all know how to get in touch with me now. My contact information is on the website. So if you ever have any questions, comments, concerns, or just want to chat, shoot me an email or give me a call, and I look forward to speaking with you all. So thank you all again.